Hello everyone. Today we are going to be talking about cell injury, and we are going to see the definition, the causes, and then the mechanisms of the cell injury. So let us begin. What is cell injury? Actually, cell injury can be defined as, or it is said to occur actually when the stress that is acted upon the cells is so severe that they cannot continue to adapt it, because we have already know that any stress that is acted upon a kind of cell, the cell has to adapt first. The cell has to start to adapt. Then when it seems the stress is not removed, then the cell will undergo a kind of injury, because it can no longer withstand that kind of pressure or that kind of stress actually that is acted upon it. So the cell injury is said to occur or is said to happen when the injury is so severe that the cell can no longer continue to adapt. Then the cell will undergo this injury. So what is the causes, or what causes this kind of cell injury actually? So that is the etiology or the causes of cell injury. So cell injury can be caused by many factors actually, but the most important one are listed here. We are going to be listed here. So number one, we have oxygen deprivation. When we say oxygen deprivation, it means there is decrease in oxygen delivery to the tissue. And this oxygen deprivation actually is a kind of broad term, because so many things can cause oxygen deprivation. So many things can cause oxygen deprivation. So but the most important thing we have to know that is ischemia. Ischemia is one of the important factors that causes oxygen deprivation. Number one, ischemia. Ischemia can cause oxygen deprivation, that is oxygen delivery to the tissue. What is ischemia? Ischemia is a kind of condition in which there is decrease in blood flow to a particular organ. For example, if we say this is a kidney, like this is a kidney, and this is the renal artery. So if something blocks here, or if something obstructs here, then the blood that is flowing to the kidney will going to be less. So you can say this kidney is undergoing, or in a condition is in a condition called ischemia. So that's it. So anything that may decrease flow of blood to the organ, we can say that there is decrease in oxygen, because it is the blood that is carrying the oxygen to the organ or to the tissue. So that is it. Then ischemia can cause what? Oxygen deprivation. And again, sometimes there is no obstruction, there is no any occlusion, but the organ can undergo a kind of oxygen deprivation, that is decrease in oxygen flow to the organ. So, for example, in a kind of when there is decrease in oxygenation of the blood, because the blood is not the one that is synthesizing the oxygen, it is carrying the oxygen from the lungs. So, in any condition of the lungs that may lead to decrease in oxygen carrying capacity of the lungs, that is the air carrying capacity, so can lead to decrease in the oxygenation of the blood. For example, in pneumonia. In pneumonia, actually, there is decrease in perfusion of the lungs with the oxygen. So therefore, definitely, the lungs is the one that is given the blood, the oxygen. So definitely, the blood will undergo decrease in oxygen. So definitely, subsequently, the organ also of the body will undergo decrease in oxygen. So there are so many things actually. So let us move to the second cause of cell injury. And anything that may lead to decrease in oxygen can lead to cell injury, as we will see in the mechanism. So in a minute. So we are going to continue with the cause. So we'll say chemical agent also. Chemical agent can also cause what? Can also cause cell injury. So from the word chemicals, definitely the examples of chemicals that can cause chemical cell injury are number one, for example, acid, right? So someone can ask, which acid? Definitely normal acid, because some like toxic acid, that is corrosive acid, for example, let's say H2SO4. When they pour in your body or in your hands, when you neglect with it, then definitely it will kind of damage your tissue. So definitely it causes cell injury, because it starts from the tissue at the tissue level. So that's at the cellular level. So again, in during the ischemia or during the oxygen decrease in the tissue will undergo a kind of anaerobic metabolism, so that to maintain its activities. So in the process of producing the energy without oxygen, definitely there is a kind of lactic acid that is produced. Lactic acid, and that lactic acid is a kind of, it can damage the cells, right? So it can, if it accumulates a lot and a lot, then it can damage the tissue. So this can also be because acid is also a chemical, right? So definitely, and also like poisons, right? It is also a chemical. It can cause injury, and again, alcohol can also alcohol. So that is it. Then again, another etiology, another cause of cell injury is physical agent. Physical agent. So physical agent substances like, for example, temperature. For example, severe temperature, severe temperature. Number one, can cause hypothermia, and hypothermia can damage cells definitely, because in severe temperature of our body can definitely lead to decrease in function of some enzymes. So definitely that can lead to cell injury actually. So motor vehicle accident, that's a motor vehicle accident also. So this is physical agent actually. And also infections. Number four, infections. Infections actually can cause cell injury definitely. For example, there are some kind of like H. pylori, for example, bacteria. H. pylori. H. pylori can cause ulceration of the GI definitely. So that is an injury to the cells, right, of the stomach. So some parasite. So and much more. So that is it. Then number five. Then immunologic. That's immunologic agent, because there is a condition called an autoimmunity, right? A condition known to be auto autoimmunity. In autoimmunity, our own immune system, that is that T cell, B cell, are attacking our own body. So definitely this is called an autoimmunity. So they can damage the cells, right? So this is an autoimmune. This is pathological condition. So we need to suppress the immune in a person that are susceptible to kind of autoimmunity on autoimmune disease. So that is it. So now we are going to see the mechanism. That is how this actually how this causes can lead to the injury. That is the mechanism of cell injury mechanisms. So all the causes that we have listed above can either cause cell injury, that is by decrease in ATP production, ATP decrease ATP production, or by actually disturbing the membrane, that is damaging the membrane. So for example, let us draw a cell here. Like for example, let me use this. Oh, let us say this is a cell. So this cell is having a kind of channels, right? A kind of channels. Let's say this is sodium channel, and then this is calcium channel. Actually, this they like to rush inside the cell. That is the calcium and the sodium through this their own channel. So, and anytime if they rush too much into the cell, it is damage. They can damage the cell. So we constantly have a kind of channel called sodium, potassium, ATPase, and then we have in this side we have calcium ATPase. So this is taking the sodium from inside, that is rushing through this, and then bringing it out, and then taking potassium, and then taking it in. And this also take this calcium that is rushing through here, and then bring it out. So this actually are actually constantly needing ATP, and ATP cannot be produced under the absence of oxygen. So anything that may decrease in oxygen supply to the cell can lead to decrease in production of ATP, and the decrease in production of ATP can lead to malfunction of these pumps, that is the calcium ATPase and then the sodium ATPase. And then when the calcium is ATPase is not working, then the calcium will accumulate, right? Because here it didn't need energy. So definitely the calcium will accumulate inside the cells, and then the calcium can damage the cells, the cell component like mitochondria. We have mitochondria here, right? Like mitochondria, like lysosomal membrane, definitely, right? So while how the sodium is causing it injury is when the cell rushes in, we have a channel called aquaporin. When we say aqua means water, aquaporin, porin means channel, right? So when the sodium rushes in, more and more, much more sodium rushes inside, then definitely water, aqua, right? Any side, any place where sodium go, water like to rush in, definitely. So when this sodium accumulate here without this sodium ATPase bringing it out, then definitely water will follow the sodium. Then when the water follow the sodium, then the cell will going to turn like this. It will going to swell up like this, and then when it swell up, then definitely this is an injury, right? Even the swelling itself is an injury, because if the cell loses its shape, definitely it cannot function, right? Because yeah, definitely, like for example, in the renal tubular cells, right? They are like this, having their microvilli, that's that brush border for absorption, renal tubular cells. If they swell up, these microvilli, they are going to be missed. If they are missed, definitely there is no increase in the surface area for absorption of things, right? So definitely the swelling, even the swelling itself, is an injury. Then this is how the decrease in ATP production lead to an injury. Then the damaging of the membrane. What causes the damaging of the membrane? We say that we have chemical factors like acid, we have toxins, so and much more. And then actually the damaging of the membrane can also be enhanced by something called active oxygen species. Active oxygen species called ROS. Example, they are, for example, like hypochlorite, not hydrochloride but hypochlorite. This like this T, hypochlorite. So this hypochlorite actually is an example of reactive oxygen species. So these ROS, they are produced during infection, and they are produced by our immune system so that to kill the bacteria or to kill the invading pathogen. So when these are produced too much, to they can damage to our cell membrane like this. They can damage the cell membrane because they are going to be attacking these phospholipid that are found in the cell membrane. So definitely this may alter the function of the cell membrane, because cell membrane is aid to in the function to inhibit or to stop too much things that passing through it. So definitely when this membrane is attacked, then definitely it will no longer inhibit substances from flowing inside the cell. Definitely, right? So definitely this may lead to injury. So that's it. So that's why infection can also termed as injury, because it is during the killing of the infection using this ROS can lead to the cell injury. So and this the phenomenon whereby this attack the membrane is called lipid peroxidation. Lipid peroxidation. Lipid peroxidation. Yeah, that's it. When they attack the lipid, because it is phospholipid here, right? Lipid. So that's it. This is the end of the lecture on the cell injury. Then in the next video we are going to look at cell death, right? So that's it. The cell death consists of apoptosis and then necrosis. Then we will see that in the next video. So thank you very much.